Hope Channel, changing lives.
Hi, good evening and once again, welcome to the program Wounds of the Heart. Another Wednesday is here and we are here to help you and help ourselves how best we be able to heal any form of wound that has been caused by traumatic experiences, psychological event, or even mental illness. And it's beautiful for us to learn and help other people who are going through the same thing. Today I'm privileged. I told you this man who promised that he will be here has once again made it a time for us to meet here. So if I said that, you know who I'm talking about already. Slick Afrique, God bless you. Always give me a fabric to sew. God bless you, Slick Afrique. On Instagram, Slick Afrique. Facebook, Slick Afrique. And if you want Slick Afrique, the contact is 0557-355-852. Just call them. They will just bring the stuff at your doorstep. This beautiful guy who always put me on the flyer and my guest on the flyer, Alpha Art. Instagram, Alpha_graphics, and on Facebook, it's Alpha Art Graphics. Any form of flyer, any form of graphic design, whether t-shirt, print, whatever, this guy is there for you. So please, you can just contact him on 0551-404-387, 0551-404-387, and Alpha Art will just deliver whatever you've asked him to do for you. So please don't hesitate. If you want to join us in the conversation, we are currently on Facebook Live, Hope TVGH, and also on YouTube, Hope TVGH. Please just subscribe, share the link to other people on your platforms, especially the youth platform, so that we will be learning a lot of things for them as they are growing up. They need to add more knowledge to what they have already. And Hope TVGH, if you want to also enter into a conversation on our WhatsApp platform, 0559-680066, 0559-680066 on WhatsApp, and you will join us in a conversation. If you want us to also, if you want to support or sponsor Hope, Wounds of the Heart, we want to go outside. We want to meet our targeted audience, those on campuses, senior high school and tertiary. So if you want to partner or sponsor that trips alone, you can call this number 0559-535554, 0559-535554, and we will have a chat with you and see how best we will, in case we need to also promote your product for you, we will do so, because you need to help us. We also help each other. Today, as I said, we have he promised, and he's here today. We had him the other day, and today he's here once again with us, just to help us, educate us, and help us cope or heal other people who are suffering from what we're going to discuss today. Today, the topic on board, you saw it on flyer. Those of us who couldn't have the chance to see it on flyer, we are discussing post-stress traumatic disorder. And yes, I'm kind of PTSD, post-traumatic stress disorder, yes. And this is, we've done that for kids some times ago, last 2 years, was last year. And today we want to do the general post-traumatic stress disorder. I always get confused, PTSD. Senior, good evening.
Good evening.
Today you're looking good.
Thank you. I think if I was the chief, I'll have the title Osiadio.
I'll say because that is wonderful. So for today's purposes, is Osiadio. So senior, my viewers say thank you so much for the last discussion that you had with us. They told me that they really enjoyed the discussion. Today we are doing the PTSD. What is post-stress traumatic stress disorder?
Okay, so as the name suggests, post-traumatic stress disorder, and I'm breaking it down for a reason.
Okay.
So it means that it's a trauma or a stress that you go through after the trauma, right? So post-traumatic, so after trauma. And then you go through a certain level of stresses or a certain level of stress, right? Then it gets to where it becomes difficult for you to manage. Then it becomes a disorder. I hope you get what I'm saying. So post-traumatic, after a trauma, which is stressful for you, to the point where it's become a disorder.
Okay.
Right? So that is what it is. And go ahead.
Go, continue.
So with that being said, then one may ask, how would I know that I'm having PTSD? So it comes with different symptoms, or what kind of stress or trauma did I go through that is causing me to have this?
All right.
And it manifests in different ways.
Okay.
So PTSD may manifest as anxiety, it may manifest as depression, it may manifest as antisocial personality disorder, which is not someone who does not like it to be with people. That is a disorder, right?
Okay.
It can manifest as antisocial personality disorder. It may have borderline personality disorder because of the trauma. You may have identification issues, right? So sometimes people who tend to go with same sex or something like that, it could be from a trauma they've been through. You could also have general managing of day-to-day activities.
Okay, so in summary, post-traumatic stress disorder, it is when we've gone through something traumatic in our life, and after the aftermath, the aftermath. So, in case you're watching and you're trying to cast your back way back some times ago when you had a severe accident and you didn't talk about it, but whenever you see those things, it reflects, or you relive with such experiences. Today we're going to discuss, probably you went through some stress and we couldn't manage it and it became a disorder. How he put it. That is what we today want to discuss, what exactly this PTSD means, what exactly is post-traumatic stress disorder, what it is, how should we know, what should we know about it, what are some of the signs and symptoms, what are the risk factors when it comes to set things, and the dangers associated, that is the effect associated to PTSD, and how best can we cope. So we're going to center our discussion on these few areas for us to understand what it really means. A friend of mine had an accident with a family, and I saw it on a colleague, not a friend of mine, a colleague on WhatsApp. I hate it when, I don't like it when in a group, probably somebody is celebrating a birthday and we are wishing a person on the group and probably a person might not be in the group.
Right.
I always want to call the person.
It has to be personal.
Exactly. So when I heard that this colleague had an accident with the family, right after ordination, so which means that a beautiful scene, going home, the family, the kids. Then I quickly called. I just asked what happened, and he was telling me about the scene. And I asked, what about the kids? I was also, and how no? Then we need to deal with the kids, because children going through post-traumatic stress, it causes a lot of, can urinate on bed, a lot of physical things can happen. That made me understand the fact that in as much as certain things happen, we need not to be ignorant or neglect people around us. Think it's a way they say, or as soon as he went through that, then he's fine. But the fact that I went through and I may not be fine, I shouldn't be compared to somebody. How will I know that this person is feeling that way, symptoms of this post-stress traumatic disorder? Okay.
So let me start by saying that the solutions that fixed yesterday's problem cannot be used to fix today's problem, right? The solution that was used to fix yesterday's problem cannot be used to fix today's problem. What do I mean? During the days of our fathers, mothers, and grandfathers, they always had incidents happen. But then the way they went about it was very different. If you use that same approach to go about something right now, it may not work. Example, somebody is in an abusive relationship, or that you tell the person is, oh, I'm not saying go divorce, no. But, oh, you know, don't divorce, so just stay. Oh, be submissive to your husband. Oh, husband, love your wife. Simple, sir. What can I say? But it's not that simple. It should not just be treated that simple.
It's that simple, okay.
If somebody is going through something for which they have a difficulty managing, just expecting that person to get over it, it's not that easy. Therefore, it cannot be taken lightly like that. Another case I'm trying to establish here is an incident will also happen to one, which would not be a problem for that individual today, tomorrow, or ever.
Exactly.
That same incident will happen to another person, and it will be the changing factor of that individual's life. So the point I'm trying to make is, what is traumatic to someone may not be traumatic to the other.
Because we are different.
We are all different, right? This one is not copy and paste where you just photocopy. If you with that card, depending on your machine, you have a line in it. So, you know, we all have to see things differently, understand people from where they are coming from. Then we have less problems with them. So talking about, if I to use the example of the kids who were involved in the accident. A family gets involved in an accident, thank God nobody passed from it, right? But then it could be very traumatic for the wife, maybe not the husband, maybe even not the kids. Right? It could also be very traumatic for the kids, maybe not the wife and the husband. It could also be very traumatic for the husband. We think that always men have to be the strong player. But it may be very traumatic for the husband, but not the kids or the wife. The kids probably had a kick out of it. Right? Oh, what a quite bomb break the daddy bomb never.
That's all.
They'll direct it and be laughing. They didn't have a problem with it. But the dad may. Right? Something too may happen today. That for now, I don't have a problem with it. And that is why the treatment of PTSD is very difficult to an extent. Because the thing happened to me right now. I didn't think much of it. I moved about my business, carried about and everything. Until years in life, now it begins to manifest.
That is a problem.
That is the biggest problem. Because it's even more difficult now. Because we don't even know what to trace it to. So you need a psychologist or a counselor, a therapist, to sit you down and take you through events in life to uncover what is causing the actions now.
He will still talk about signs and symptoms. He will talk about it. In as much as sometimes pastors, people will come to us for an issue.
That is even traumatic for the pastor.
Please, let us not put prayer all the time to cover certain things. The history about the person is important. So as he said, a clinical psychologist or whoever, counselor will start. So have you ever had this thing before? Have you met this thing before? Before the person, yes, I remember. Then that becomes the base for the counseling to begin. Please, in as much as we are church leaders, we are pastors, unless you have you are a certified clinical psychologist or counseling psychologist or a counselor or something of that sort, please let's refer, so that we will support it with prayers. And they will do the talking. Because as he's saying now, post-traumatic stress disorders would never happen right here now. It may come after 10 years, 15 years, where certain things start coming in. The person might think that it's obi chronic but ABI, it is about something that has happened when the person is young. Senior, how will I know somebody suffering from PTSD?
So now, some of the symptoms, and symptoms present differently for everyone. You probably have heard me say this before, right? Let me say this about the pastors and prayers. Now, for those of you who are on social media, the Twitters, right? Let me say this, and you can tweet it. You don't have to copyright it. It is okay to have Christ and to have a therapist.
Beautiful.
Did you get that? Beautiful. It is okay to have Christ and to have a therapist. So please, there is no shame in me seeing a therapist. There is no shame in me seeking for help. Because it's my health. And there's no health without mental health.
That's what
to that one too. Okay, now to the question. How do you know the symptoms? It presents differently for different people. So in kids or adolescents, it may come up as truancy. Someone not attending classes, not going to school. It may come up as being defiant, someone not following rules, not being obedient, right? It may come out as bedwetting, right? Someone who sleeps and pees on the bed or urinates on the bed, okay? that is the kids, adolescents. It also may come up in retrogression in behavior. Example, someone is around 30 years, you expect them to act this way. Then they start acting like someone who is 8 years, right? That can also be a symptom. Then it also may come up, and these are some of the symptoms that is not usually talked about. That's why I started with those first, because I know what you're waiting to hear, and I'm getting to that. So what we typically see here from people who have PTSD is, I have nightmares. Whenever I go to sleep or whenever I'm alone in my thoughts, I have these weird dreams, weird feelings, nightmares, right? So it's not where you've eaten so much where and now you're having some of your bad dreams. It is not where you have severe malaria and you're having bad dreams, right? I always want to do some distinction and also bring it together so that we don't easily confuse one with the other or just lump everything into one. So it is not when you've had too much to eat because you went to visit pastor and then he sorted you out good, right? And it's also not when because you are sick from malaria or fever, which means that these things can also give you some bad dreams. But this is not what I'm talking about. This is where you have some serious nightmares where sometimes it wakes you up and you are panicking physically when you wake up. Okay?
Senior, please, let me ask this. If post-traumatic stress disorder, PTSD, can let somebody have serious nightmares, then you see, some of us, okay, let me say this. You see, on our prayer groups and stuff like that, we always call for bad dreams. But we haven't taken notice or time to probably descend on the person's past life to know what exactly is causing
that person to have that.
Pastors, today, please let us be mindful about this. In as much as somebody will come and tell us that he or she dreams and flying and on the water and whatever, we always associated it to spiritual thing. Fine, it's there. It's there. But,
very good.
But have we ever taken time to descend on the person's life and ask whether the person, as he was growing up, had met a traumatic experience that is manifesting that time we are making? I think let's make this thing a point and let's try to see this so that we wouldn't be covering things with prayers and with anointing service and stuff like that. Senior, continue.
Okay. So where you have nightmares to where it will wake you up and then you start having your chest pounding, palpitating. You know, sometimes you sweat from, it seems like you had some extraneous activity, serious activity going on, where you physically feel the symptoms, right? So that also happens. Usually also PTSD is linked to people who have been to war. Usually. Okay. And I just want to bring it home. That is why I'm taking you this time from what you know to what you probably do not.
Okay.
Right. So usually it's linked to people who have been to war where, Charlie, I mean, so they see too much. So with the killings and all of that, people that you went with and something happens to them as your body, those becomes traumatizing for them, right? So in most cases, we link PTSD to people who have been to war or been to a traumatic scene of that nature. But it can also be with so many other conditions, and we'll get to that.
Okay.
But once again, the symptoms. So I've already talked about the
dreams from the kids,
dreams,
the teenagers,
the nightmares, the defiant behavior, the retrogression of their behaviors and stuff like that. So those are some of the symptoms that you typically see.
Okay, so with our kids, we expect our kids to be doing certain things and our children to be doing certain things at their age. And we need not to just start spanking them like that. We need to talk to them on it. We need to ask them questions. We need to friend them to know what exactly is causing that truancy. Why aren't you going to school again? Probably there might be an abuse. There might be something we might not know. Right. So we need not to just raise that fatherly voice or motherly voice on our children, but let's talk to them. Let's speak to them because probably they might be going through PTSD. They might be going through that. So please, I watched this movie that when it was a life story. Then they used it as a movie, where the military man, after war, came back home and seeing the wife like an enemy. And it took the intervention of the military men to come and capture this man from his house, because he could have killed everyone. Simple,
and it happens. It happens in some jurisdictions. And that is why sometimes, I don't know about the Ghana military service, but when we discharge someone from a service, and not just the military, you know, if you have, as a pastor, and then you just laid off where you feel is very unjustified, it's very traumatic, right?
Exactly.
You may exhibit in one behavior or the other, right? So it happens. If you do listen to the news of the United States, if you watch CNN or something like that, you realize that there's been a shooting at a workplace, at a school place. Typically someone that has worked there before or have been to school there before. It's usually not strangers, right? Usually, you remember when we talked about abuse? Abusers are typically people that you know.
Exactly. Right? Exactly.
So in this case also, yes, that happens. So it is not spiritual. And please, I'm not saying that spirituality does not exist. Far from that.
Yeah.
But my knowledge is not in spirituality. So I always say this, and this is my disclaimer right here. Let the people of the spirit deal with the things of the spirit. Let the people of the flesh deal with the things of the flesh. So what we need prayers for, no two ways, let's get it. What we also need to use our physical, intellect, knowledge, and physique to do it, let's do that. So back to PTSD. You know, with this trauma that they go through, it will exhibit differently for different people. As you mentioned, the one that went to war, came home, sees someone as an enemy. That happens to where the family will be in danger. So when we are discharging anyone, and that's the point I was making, from any service activity, let's make sure that we're doing it with a human face. Let's make sure that we're providing them with the assistance that they need psychologically to be sane enough to go home and take care of business. If not, then you are just mounting problems up, which will manifest one way or the other for sure in our lives. Let me tell you a story. Live one. This is not a movie. I had a patient, and I have a job where I do house calls, right? I go to patients' homes. And this was out in somewhere, like a place I wasn't familiar with, not too many houses. And this was an ex-military guy. He had right below the knee amputation, right? So his leg was cut off below the knee. And he was in his chair. As I was talking to him and assessing him and everything, then I asked about his service history and how he feels when someone walks up to him. Please, with this analogy or example I'm giving, I'm trying to build points in here, so follow me. So how people walked up to him and everything. And then he said, please do not ever come from my back. That is one thing. People with PTSD, if theirs was that the trauma was something that happened, do not ever do that. Somebody will tell you, please do not ever scream from my back. Somebody too will tell you, do not ever walk up on me. So before you get closer, announce yourself. Do you get my point? He
might hit you or something.
Hey, he will do it without thinking. Poor impulse control. He will act before thinking, and usually they don't regret. It's because of their training. Nothing, you know. Usually they don't regret. So somebody to tell you, please do not ever walk up on me. Before you get closer, announce. Right? Somebody to tell you, do not touch me. Not the Alatas, I'm not, don't touch me. But they'll tell you, do not touch me. It's because of a trauma they have been through. So whenever we're having any relationship with, any form of relationship with anyone, let's get to know the person. They may not tell you all that they've been through because it's not necessary. And, you know, some people, they hear with the ears and it comes out of the mouth. They have mouth diarrhea. So whenever they hear, they speak it. So I wouldn't want to tell you everything I've been through, but what you need to know for us to maintain a relationship is what I'm telling you. My mom always used to tell us this, or comfort no better no. So the fetish priest that will want to stay with you is the one that tells you what they dislike, right? So if I'm telling you something, sometimes don't ask too many questions. At that point, Maybe with time, as we develop our relationship, you'll get to understand.
Exactly.
So I've talked about walking behind someone,
no screaming,
just walking up on someone, surprising. Hey, Master, you surprise yourself. Don't scream at the person. Don't just touch the person without their consent.
Okay.
Right?
Okay.
Oh, hey, do you have something on your shirt? Do you mind if I take it off for you? You have all the good intentions. But if the person feels that it's a threat, they'll respond. Right?
Okay. Okay.
For people who are huggers, hey, be careful who you hug. Because once you are in that space, if I have that traumatic experience and my reaction, I may squeeze you some squeezing beer or hug in a better way.
It's true.
So trauma presents differently for different people. We act differently from one to the other. Okay. So I've made a point with this guy. So those were some of his things because he was a Vietnam War person.
Okay.
Right. So, and then this is the other thing too that he said. Our training was very different. It's not like the military of today. Ours was clear everything and find out what is in there.
So you don't have sympathy for?
No, there is no questions asked. So if you have to do anything and he wants to react, there's no if but. His action is to take care of business and then see what happened.
Oh.
Do you get my point? So based on his training, once again, the nature. Nature versus nature. The nature. This is how he was brought up. Environmental. This is how he was brought up. This is how he was trained. So if he is to go through the market and then suspect anything during the time they were in service, suspect anything, you kill everyone, and then you go and find out what is in there. Because the enemy might have a grenade.
Yeah, okay.
Right?
Okay,
so based on his training. So they don't play. If you're dealing with someone from that generation, you have to be careful. I'm one that, I don't know if, I think it will be safe to say, I'm one that I don't use guns, right? I don't. And I've never held a gun and used it before. Though my siblings, my dad was in the military, I have siblings who have been and who is in the military. I have friends who carries a gun. I don't. So I was assessing this guy. We talked like 2 hours. That's the longest patient I've been with. So I was talking to this guy because I joined his story. And then he just pulled a gun out from where he was sitting in his living room. Because remember I told you this was in the middle of nowhere.
Nowhere. You don't know.
I'm a black boy.
Yeah.
He's a white older man. We're talking about America. He will shoot you. I'm not being prejudgmental, but it happens, right? Okay. So this guy just pulled the gun out. I was like, he was like, why do you? I was like, child, I don't play with guns. So I told you I don't play with guns. And then the wife was like, honey, put it back. Then he was like, oh, no, go ahead, take it and it's locked. I was like, dude, no, please, thank you. Then I asked him the question, why are you sitting in your living room and carry the gun? He was like, you don't leave your weapon. Oh, okay. We're talking about PTSD, and I hope you're following what I'm...
Exactly.
Okay. You don't leave your weapon. So he was sitting there with his gun. And he also says something. I don't sit anywhere with my back to the entrance or the space, the empty space.
So it should be behind the wall.
Always the back is to the wall. Therefore, I can have a full glare of what is going on. So now, let's bring it to the church or to a group. You may have someone in your church who comes to church and have a particular place that they sit. Okay. You don't understand why.
Okay. Okay.
It might be from a trauma that they've been through.
Okay.
It might be a training that they've received.
Okay.
It might be for one reason or the other. Therefore, they do not sit where they cannot see the entrance. So deacons and deaconesses and the Sabbath school superintendents especially, because that person still wants to come to church early and decides to sit somewhere. The person may try to be a meeting and me bantam. Because I want to sit where I am sitting. That is why I came early.
Get in there.
I also understand the point of the ushers when they want us to move forward. I perfectly get it. But the point I'm trying to make is let's not push so much when someone is not budging because they may have a good reason.
All right.
Okay.
So someone
Thank you for cutting me because if not, I'll go.
So somebody who has had issue with lorry accident, a serious one, probably definitely when the person is sitting in a bus or journeying to a place and there's you see around the person.
They feel uneasy.
So as we were discussing, I want to take a quick break and I'll get back to you. But just tell a friend that we are discussing post-traumatic stress disorder in people. So please, you can share the link and let people listen because it's very educative and we need to help you. Please don't go anywhere. I'll be right back.
We want to defy our family's decision and get married or elope. I need advice. What should I do?
Please, what should I do?
How do I tell her I cheated on her months ago? I need help. What should I do?
Okay, so for me, the moment I read the story, the first thing that came to mind was, wow, knowledge is indeed power. Sometimes we go through situations because we have no knowledge of how to go about them.
If you come from a home like that, you are likely to accept anything the outsider would, direct at.
The fact that we had an interesting ceremony where a priest prayed and all of that doesn't mean that magically you have turned into something else.
If he finds his way to God, a Bible-believing church, and he goes and he wants to change, nothing is impossible.
His properties to charity and stuff?
Oh no, why? Okay, I think this is another discussion that we will not end today, so we will not even go into it.
Real Talk, showing this and every Wednesday at 8 p.m.
Hello everyone, my name is Dr. Mami Ifuakosa and you are welcome to my consulting room.
In the consulting room, we listen to you, we examine you and find solutions to your health and wellness.
In the consulting room, we listen to you, we advise you. However, we advise that anytime you feel unwell, you feel sick, kindly visit the hospital, see your doctor and have a thorough checkup for best medical care.
Your questions and your suggestions are highly welcome. Kindly send them to us on WhatsApp 055 968 0066 or through email at hopetvghana@gmail.com. Join us every Monday at 8 p.m. on Hope Channel, your preferred Christian TV station.
Thank you so much for staying with us. We are discussing post-traumatic stress disorders and its effects. So we are still dealing with the signs and symptoms. So in case you just join us, that's what we're doing. If you want to share your comment or send any comment or question or whatever, you can do it on our WhatsApp platform. That is 0559 680066. Or on our Facebook page, we'll have time to reply you all those messages. And just let me tell you. So, Senior, you were dealing with the symptoms of, and I posed the question. But in all things we are discussing in this PSTD, you made a point with this man who highly. And you're talking about the ushers, you're talking about the deacons, how as to. These are the sciences. You see, we don't go into to know why something is happening or why this person is doing that. In as much as you're saying that we want orderly, like the sitting arrangement should be on point, blah, 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 like that. Fine, it is beautiful. But it's a church setting. I know we can't blame them, but we can help them. We can't blame them, we can help them. In as much as we have, that's the general. You told us about the what we see in children when they are going through, and the general aspect. Do you want to add to a symptom? Then we move on to the next question what really causes, or if there's any risk factors when it comes to PTSD. Then
okay. So as part of the symptoms, and I was using the man's thing, and we got to where, you know, he always wanted to sit with the back to the wall and then be able to see everything. Yeah. The other thing also is that someone with PTSD, depending on what the trauma is, will have a special way of doing certain things. I have a, I call her sister, right? A church family. She cannot drive on the highway, especially when there's construction with those barricades. She cannot. Because of a trauma she had. She had an accident on the highway. So anytime we have to travel or even go across a highway, somebody has to drive. PTSD. That's what we're discussing. So everybody's trauma is different from the other. I also had a lady that I went to school with. She could not drive past a bridge. So anytime we had to go to clinical across the state, right? We lived in Ohio. The clinicals was in Kentucky, so we had to cross the river. There's no two ways about it. She would always park at the bank of the river, join someone, lay flat in the car. Yeah. So people's symptoms, some may be mild, some may be...
Depending on the person.
Yeah, depending on the person, how they react. Some may be very, very severe. The ex-military guy that I was talking about, as part of the things that he had done due to his traumatic experience, he threw the wife across the room because the wife walked into the house unannounced and into his room.
Because that's what he told you, like that's why he hit it.
He acts before he thinks, and that is how he was trained. Environment. So he acted on it before he realized, that's my wife. There's no harm. But the wife had already flown across the room already. Yes. So people act differently. For some people, yes, you do. They'll startle and then recollect and then be like, oh, Pacho, next time, yes, sir, right? Or next time, don't do that. But some people, you receive a slap before you even.
And we think these people. Or one or somebody why, but not know. We don't know actually what the person have gone through before.
We don't, and you don't have to.
It affects our marriage. I know we'll come back to it, talk about the causes and effect. But in as much as you are married to somebody, our counselors we need to do a lot of work because once you are counseling a new couple to marry. There are issues we need to tackle. We need to touch on. If the wife to be or the husband to be has gone through certain things before, it should be made known so that we can tackle it. And as how best the lady or the guy will cope when these things are coming is a plus. Please, I think that these are the things we need not to look down upon. It is part of divorces as the raging effect of divorces. So please let's deal with it and let's see how best. Senior, the risk factors when it comes to PTSD and probably what may cause something of that sort. What are some of the?
So as mentioned earlier, trauma comes in so many forms. So let me give you a few examples. Right, one, a child being abused at school. It may be traumatic for the child. A child being abused at home. So any form of abuse may be traumatic, right? So if you've ever heard about the ACE study, the adverse childhood events, right? That study that they did. So what it came up with in summary is that any adverse experience a child has, which means that something that is not good, that the child has an effect on the person, including reducing their immune system, right? Including psychiatric conditions, including poor performance at school. So any form of trauma to a child, so any form of abuse could be traumatic. So now let me get to some of it. Emotional abuse, neglect. You live with a child at home right now due to a busy lifestyle. We need the money. Therefore, the child is always abandoned at home. And I'm using my words advisedly, abandoned at home, right? Because we have to spend so much time at work.
Outside,
Then the child feels neglected. That could be traumatic for the child. So it will come to a point where the child do not want to associate with people, do not trust the society, right? Now, let's also get into sexual abuse. So a child is abused sexually, or even not just a child. Someone is abused sexually. It will affect them growing up as to which sexual partner they want to be with, their sexual performance in bed or in marriage, right? So as you gave the example, someone who is married and going through, or someone who is about to get married and going through counseling, do we talk about that? So I had one patient who always had a problem whenever she had to mate with the husband because of the trauma she had been through before. Is the husband aware of that? Was that discussion had? Was there a plan in place to deal with it? Probably not. I also had, just last 2 months, we had a lady come to church. She was not a member of the church, but she just visited. And then afterwards, as we do as Adventists, typically, the leaders met with so pastor had a meeting, so another elder and myself met that lady. And then she was talking about her having nightmares when she sleeps, having anxiety. Sometimes her chest palpitates so much. Sometimes she feels like she can't move her hand, like stroke-like symptoms, right? All from that. So when she was talking about it, the other elder is a nurse. So he was asking more medical, have you had a stroke? Have you had this? All of that. Then I was like, have you had any trauma happen to you? Then she was like, oh, not really, but, and then went on. Then I was like, have you had any instance, or can we collaborate this? When you're having a conversation, or when something happens during the day, during the night, you have a bad nightmare. Then she was like, oh, when I was younger, I think like 18s, now she's like late 40s or early 50s. In her late teens, she was raped by a guy in the area.
Okay.
The guy now lives in UK. Periodically, he calls her. So anytime they talk, the night is worse.
It's worse, okay.
And now because now there's a re-established contact, periodically, if there's a conversation or not, she has panic attacks. So sexual abuse can be traumatic. The other thing also is, unlawful dismissal from employment or anything. That could be very traumatic. The other thing could be accidents. Even being at the scene could be traumatic.
As a witness, Paul.
Yes, even as a witness, not the victim. As a witness, could be very traumatic, right? Even as professionals, pastors, psychiatrists, whatever role you find yourself in, dealing with certain people with a lot of problems could be traumatic also for you.
Secondary trauma.
Yes. I did a program somewhere where, I think it was Chicago Church, where somebody asked me that, so how do you deal with all these problems that people bring to you?
Caring for the caregiver.
For me, I compartmentalize. So my mind is all divided.
That is how God
so
has
you bring
made
yours,
us now.
I put yours here, I finish, I move on.
It's gone.
So sometimes I do like sessions with people. My nephew is a tech, right? And once in a while, he will call me and be like, menya case amao. And that's something I charge for when I do those ones. So it's not like because it's my business. No, it's just because he has a friend or something who's going through some difficulty, and then
that long time.
So you get all of these coming on, and sometimes it's very traumatic and draining for you also, right? So you might want to take care of yourself. If you're a nurse or a healthcare worker, the events that comes through the hospital, accident scenes, patients acting out, you've been slapped before. If not, get it. But all those are nice experiences to have in the hospital setting. So, all these things that you go through, how does it affect you later in life, right? So, and then we also have those that have been to war or been in the military, the security services, robbery cases as the victim or as a witness, right? So any of these things can be very traumatic to an individual.
And if you grew up in an environment where there were these bullies and
fighting was part of it.
Fighting, and you were once beaten by this guy. Whenever you see this guy, you remember. You don't want to meet him. You don't want to go there, even if you guys are growing. But it's traumatic to you. But to somebody else, say, oh, as for this one.
Right.
But as he said, we are different people altogether. What will make me go through that serious traumatic experience wouldn't allow you to go the same way. So we should be very careful about how we treat others. What are the effects of PTSD?
Poor relationship, first thing. Poor relationship. 2, poor health to the victim, right? So let me start with the poor health. Let me start with the victim, and then we can go to the people that are affected. So with the victim, I have PTSD, and I want to narrow it down. You can always make it suit your situation, but I can't always use every situation as an example. So let me narrow it down. Let's say I am a rape victim, and then I'm going to get married. Always at the back of my mind, I have that thing going on. So I am thinking that how am I going to be with my husband or wife? Then I'm also always thinking that, hey, if this person does this, is it because of that? Right? So if I'm to go to my wife to be in bed with, right, or to mate with my wife, and then he or she, he in this case, no, she in this case, refuses, then is it because of X, right? Sometimes also as the female, in most cases the female, when you are having an intercourse with the husband, your mind is still on that trauma that you went through. So then you picture this monster on top of you. There's no sexual satisfaction. Never.
Exactly.
Right? So how is that also affecting the relationship? So let's still talk about the victim. You also have this anxiety going on. A little bit of anxiety is always good. No problem about that. But when it becomes constant, this is what is happening. You're always thinking about it physiologically. You start to respond to it, right? So your stress level goes up. Anytime your stress level goes up, your immune system comes down, right? Okay, so now you're getting more sick from medical conditions. So you may be getting frequent sicknesses, which may not be medically caused, but psychologically caused.
Okay.
Right? So you're having these manifestations due to the stress that you're going through. Other thing, you're constantly having your heart beating faster. Right, palpitations.
Exactly.
So as you have that palpitation going on, it becomes the baseline. So now, look at this. Your heart is supposed to be like this, right? Pump, pump, pump. Now it's beating, pump, 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 pump. It's a muscle. It will get to a point where it cannot sustain. Then it starts to have cardiac issues.
Okay.
So you have high blood pressure, which is just because you're eating too much salt. Which could be a cause. But it's not because of that. It's because of the anxiety that you're constantly having.
Exactly.
Right? Now you have to get a pacemaker, stent, and all of that. So those are some of the things that as the individual, the victim, you can have. The other thing now to the next person, poor relationship. In most cases, whatever I am going through will affect people around me. It's just natural. Because I am reacting to something which will then impact our relationship. So, example, with the rape victim, it is going to affect our relationship because I always think about that monster that did that to me and therefore see you as such. The other thing also is because of that, I don't relate well with you. Whatever the trauma was, right? I always feel that you are also going to do it to me. Broken heart. Somebody goes through a broken heart, has that as a traumatic experience, poor relationship, because anytime I'm going through another relationship, I have a feeling or a thinking that this person is going to do that. Probably the person cheated on you by always saying that I'm going for work meetings, but then we'll be somewhere else. Therefore, as the legit husband, who is not really doing that, has to go for a work meeting, you know, for one reason or the other. Aye, is it that thing coming back, right? Poor relationship. The other thing also is probably I have a traumatic experience, therefore I don't want people touching me. You've met me, we've not met in so many years. You're so happy. Hello, hey. You see what I'm saying? So if even I try to hold back, I may not give you that warm hug, right? Then it feels like, this guy, the wrong guy, me, you know, you go come on, come on, none of you. But it's not because I don't want to relate with you. It's because of something I've been through. So if even I'm trying to hug you, Charlie, my mind know they settle. So it's making it difficult for me, right? So those are some of the ways it affects our relationships. Maybe no ill intent. I'm sitting, you come behind me, you tap me, Charlie, reflex, right? Flat in the face. Oh, Charlie, by the time we settle, you already have that feeling against me that Charlie, he hit me on purpose. Maybe we had an argument before.
Maybe then we just exactly.
Then it's like, oh no, it's because of that. So Charlie still say hit me, something small with a joke about. But it was not because of the wrong joke. No, it was because of the approach. So it always also affects the relationship. So it affects others, it also affects us.
How do we help people in this condition?
One, let's know what the trauma is, or let's know what they like, do not like, right? So in helping, in treating, in providing any support at all, we have to know what the issue is. If the person does not want to go into details, that is fine, but hey, how can I help you, right? Let the person know that you're there for him or her. That is one. Two, let's respect the person's wishes. Sometimes we ignore the feelings of others. Oh, it's okay. Oh, it's normal. Charlie, I'm different. I'm not that person.
Exactly.
My experience is not the same. So for some of us who always want to hug, who want to greet, who wants to be in the space of others, some people don't want you within certain feet to them. And these are real experiences. So as you're talking to them, you get it closer. Either their expression changes or they step back.
Yeah, exactly.
Please don't take it personal. Right?
Exactly.
It's because of what they're going through. So respect that person's wishes. That is how you can help the individual. If that person has, once again to the church, I have a position that I really love to sit. I may not be able to tell you why, the full story. But if you tell me, come forward, you've done it 1 week, second week, third week, I'm still not doing it, understand it.
Other than that, the person will leave the church or something of that sort.
Silence is a language. Learn to understand it.
Exactly.
So though I did not answer, I am telling you that I will not move. This is where I'm comfortable. Understand the language I'm speaking, and let's move on. Right?
Is there any related conditions attached to PTSD? Can we have related issues? For instance, if somebody is a drug who smokes weed, will probably be adding certain things to it. With the case of PTSD, do we have any related conditions?
Yes, there are other related conditions. Example, as I talk about the medical conditions, right? The palpitations and stuff. Anytime you have the trauma happen, also, the reflection of the trauma happen, you may also have diarrhea.
Okay.
What is it? Assembly synonym. It's a figurative speech.
Exactly.
Yeah. So it happens, then I go. So yes, that can also happen. The other thing too that can happen in terms of medical is you constantly get sick because of your poor immune system.
It's okay.
Right. The other related condition could be other medical psychiatric conditions. So you could have depression based on that. You could have anxiety based on that. You could have borderline personality. And the borderline personality people are people who have poor relationship boundaries and self-harming behaviors. Right? So yes, you can have that. You can have antisocial personality disorder, people who do not have respect for the social norms. Not people who do not want to relate with others. People who do not have respect for social norms. Yes, you can have that also. Because of your traumatic experience, because of your upbringing, your training, you don't have respect for those social norms. Therefore, the way you act in certain spaces are very different.
Senior, my time is almost up. What would be your message so far as PTSD is concerned? How should we look at it? How should we get to it? Because from what you're saying, it doesn't show on our faces that something had happened. It doesn't show anywhere. That especially with our children who doesn't know anything and they start having nightmare or urinating on bed or something of that sort. Parents beat them, sometimes shame them. We stigmatize around them. We put them somewhere, and all these things we've talked about. We need to get closer and love to them. As a mental practitioner, as a nurse, somebody who deals with it, what would be your counsel when it comes to PTSD?
So first thing, there is medication for treatment, right? To treat PTSD or to manage it. So yes, you can see a psychiatrist or a doctor and then get some medications to help manage the symptoms. The other thing is therapy. Therapy does a lot of stuff, right? A whole lot. Once again, you cannot use the solution of yesterday to fix the problems of today. So those days, yes, we never went to therapy. Family dynamics took care of most of the things, or you just harbor it and you were still fine. Nowadays, if you try doing that, you kill yourself. So the dynamics are changing. Therefore, let's seek help. It does not always have to be. I will advise that it is with a professional, but it does not always have to be with a professional, especially starting off. Because I may have a problem where I can talk to pastor, and the pastor will give me an advice on it, or give me some therapy session, and I'll be fine. Okay. Right? But then if it moves beyond where what pastor is saying is not cutting it, then you have to go to the other. It could be with a friend, right? So what do we do? How do we manage it? You are my friend, and because I want to keep you as a friend, therefore I have to let you know what I like and don't like. So you have to open up, have that open conversation. I don't have to go into the details, all the details about what is going on. But as much as you need to know, I have to tell you, and then we keep our relationship, right? So you just have to manage the symptoms, and then also medications if it's so desired or needed.
Yeah, it's well said. Viewers, I told you we are learning. We want to help other people. We want to help you. You may be going through, you just recollected some trauma experiences that you have gone through, and it's still eating you up whenever you see that person or you hear anything about it. I know somebody who was, the father was killed by one of ex-military or whatever. And she didn't tell me, recently she told me about it. And she said, so whenever she hears that man's name, Charlie, you see, it takes time for such person to live without thinking about that.
That is the other thing too. Healing is different for everyone.
Exactly.
So just as we react differently, what may be traumatic to me may not be to you, so also is healing. So somebody may go through a traumatic experience and then after 2 weeks, they're done, they're fine, they go on, right? Somebody may have the PTSD, which is something happening to them like 10 years down the line. Yet they go through like 1 month of therapy, they find they go on. Yeah. Somebody sticks with it for like years. So it's different for everyone also.
So let's get to know anyone who is around us. Let's get to know what they want, what they don't want, what they like, what they dislike, and let's give it to them. And I'm sure you're going to live with a person happily for a very longer period of time. In our churches, let's be mindful about these things. In our community where we find ourselves, in our offices or working place, let's be mindful about, so that we shouldn't tap people that, as for these people there, they might be going through a lot of things that they need our help. As human as we are, they need our help, because we can't live in isolation. We always need somebody at a point in time as we are moving on in life. So please, let's be very mindful. Today we discuss another sensitive topic when it comes to our way of living or way of being as part of human life. And the post-traumatic stress disorder is certain things that it's something that we need to hold on to. Just educate ourselves, teach it at our church places, even offices, banks, whatever. There are times you need to leave off that busy schedule, organize such programs for your workers, because in as much as somebody is a banker and a teller or something, and at the end of the day, there will be a shortage after balancing. Psychologically, that person might be disturbed. Whenever bank is delaying, he or she may think that I am here. So please, psychologically, a lot of us have issue. So if you work in a bank, you can suggest it to your HR for such programs to come in. When you call upon us, we'll be there. He will be there. He will be there, whether Zoom or whatever, so that he can take us through such sessions, because it's important for us to be mentally well, for productivity to excel when it comes to your jobbing field. I will thank Alpha Art for the flyer. Alpha Art, God bless you. Instagram, Alpha Art Graphics. Alpha Art _ graphics, Facebook, Alpha Art Graphics. Thank Alpha Art. If you need him, 0554 404 387, 0551 404 387. And Alpha Art will just connect with him and he will do your stuff for you. Anything graphics, he's there. Anything graphics, he's there. And Slick Afrik, thanks for your fabric. Slick Afrik, and Instagram, Slick Afrik. Facebook Slick Afrik, and their contact 055-7355-852. Call them and just select any fabric you want, and the dispatch rider will bring it just at your doorstep. No hassle. Don't go to town. Just sit at your comfort zone, and they will come to you. And I also thank my senior, Philip Ofori, to me, who had been so much of a help since he arrived here in GHN. He has given me his word, and he will come again before he leaves. So let's expect his last time with us here on the studio before he leaves. And I also thank you, the viewer, for making this program a beautiful one. I'll still seek your input whenever you think that you have somebody that can sponsor this program or can help us on our campus store. We'll be very glad. Let's the person call 0559-535554, 0559-535554, and we'll have a chat and talk about how best things will be like. Thank you so much for having time to watch us. Senior Philip, God bless you for your time once again.
It's an honor.
I hope to see you again before you leave, and you hope to be there whenever it's 4 o'clock every Wednesday on Hope TV GH. I've been your regular host, and the name is Pastor Dana Bidieba. I'm out.